So basically, I'll just start with a introductory note. So before I just jump on, let's assume that one of you is a doctor here, and you get a call from some emergency, and the best thing that can happen with a rap is direct view of the ultrasound right here. So it's ultrasound, CT scan, or just name anything. It will come right from diagnostic center to your phone. And this happens in the record of less than 30 seconds. And this comes up even from a extremely normal internet, normal GPRS. That's why we call it as clinic on the go. And so, next slide please. So we are a company where we work on extreme technologies that are from a technology level, but to a common man, it's a clear use case and a usability scenario. Next. We have about 25 patents, and I have used 5 of them in bringing up this technology of clinic on the go. I'm an inventor, and most of these technologies have been my brainchild for a period of time. Next. Yeah. So clearly here, the road to go in terms of the healthcare is on the way mHealth can bring up. From a critical number point of view, what we just discussed in the morning, we still are looking at about 150 million internet users, versus more than 900 million mobile users. And we have come up with a system that will actually use the best of this without much of technology changes. Next, please. So what we do here is basically in terms of bring up the ecosystem of the healthcare, and we have supportive situations on how we can take it forward. Interestingly, today, one of the important contributors of internet on mobile has been with the camera. The camera mobiles actually brought in Java and subsequently the Androids. So this is one of the core scenarios of how we are able to penetrate to the mobile healthcare. So this is clinic on the go. Next. We had this launch first with Samsung on their 10.1 and 8.9 inch tabs, and after this, so these are the critical or basic challenges that any doctor would look at. Next. First thing is the healthcare itself from an automation point of view is expensive, number one. Second, in terms of utility, how often have you seen a doctor with a laptop? I mean, even if you see from a high-tech scenario also, the penetration of the PC or the direct automation has still been a critical issue. But interestingly, most of the doctors are somewhere inclined to a tablet or to a handheld because it's less complicated and it's mobile. So practically, with our solution, we were able to bring down from a 3 lakh to 15 lakh rupees kind of a setup to as low as 20,000 rupees. Next, please. And we are agnostic to any device, so it just works on any device, and it's not specific to a particular platform. Next. And so this is a quick shot of what is possible. And one of our very important applications that has raved a lot of doctors is the ICU monitor. So sitting right here, I have an access to a popular ICU setup in the country, and I can straight away go to a particular patient and then bring up the ICU. This is the ICU view, and this is live from a ICU setup. Next, please. And this is for the patient, and the moment any registration is done, the EMR is on the cloud, and it can be accessed by any patient anywhere. Next. And we stand for this go green scenario because you can actually replace a lot of RAD images plus prescriptions directly with the e-prescriptions and m-prescriptions. This is the delivery mechanism through private and public networks. And we also have a one-touch video consulting system, which is a part of healthcare, which is used primarily for e-health. And so far, in less than 6 months, we have 600 doctors directly using it, and more than a lakh of patients being registered on a unique basis every month. And the next thing is we also have these things come up, and from the ecosystem point of view, what we really look at is the fact that the clinic has to be as mobile as possible, and it has to ensure that the clinical solutions are anywhere. In this whole system, the benefits that we are passing on is not only for the doctors and patients, but also to the mobile operators. In fact, in our own study, the kind of bandwidth that the doctors and patients are using is tremendously increasing. At the same time, there's also a lot of drive in terms of what a patient can actually get benefited from and what a doctor can provide from anytime, anywhere scenario. This is Clinic on the Go. Thank you.
Thank you, Ravindra. That was a lovely presentation.